In this video, let's understand about pregnancy, vaginal childbirth, caesarean section and its relation with the back pain. Pregnancy is a very exciting phase in any woman's life, but it can come with unwanted low back pain. There are various reasons for back pain during pregnancy, first of which is increased weight. During pregnancy, there will be a lot of weight gain, and this weight gain will cause lot of pressure on your spine and your pelvis. Second is the incorrect posture. As the pregnancy grows, you can see here that as the baby grows in the tummy and the breast size increases, that leads to a slouched posture, as well as this leads to the shift of your center of gravity, leading to excessive weight bearing on the spine and the pelvis and back pain. Other than this, as the tummy grows, your tummy muscle, or you can say your six-pack abs, that is medically known as the rectus abdominis, goes for a separation. Your right muscle and the left muscle spreads apart, leading to weakness of the muscles and back pain. Along with this, your body would prepare you for a childbirth or a vaginal delivery. During this process, your body will release the hormone which is relaxin, and this hormone will cause loosening of your ligaments and joints, specifically the loosening of your pelvic, or you can say this portion, because from here you are going to deliver. So this loosening of your ligaments, joints and muscles can also contribute to back pain during pregnancy. Vaginal looseness. Now let's understand this word vaginal looseness. So I am just zooming this picture in so that you can understand it better. You can see this is the side section, I mean the way you are seeing me from the side view, and this describes your back, that is your spine, and this side is your tummy, that is your tummy, like this. And inside this you can see this is your womb, that is your uterus, and inside the uterus you can see the baby. Also beneath this red colored thick line which you are seeing, this red colored thick line is your vaginal muscle or your pelvic floor muscles. As the pregnancy progresses, as your baby will grow bigger and bigger, you can see that your tummy is growing, the baby grows and the tummy comes out, but at the same time your vaginal muscles or your pelvic floor muscles, they also become loose and weak like this. You see here in the next slide, the baby is growing, I am zooming it again, and the baby is growing, and as the baby grows, there is lot of pressure, strain which comes on your pelvic floor or your vaginal muscles. So in the earlier slide, you saw that your muscles were thick, but as your pregnancy is growing, your muscles are becoming loose and weak and lax. So as the pregnancy grows further, you can see now the baby has become big and it has covered all of your tummy. So similarly, your muscles will become more loose, lax and weak as the pregnancy advances. Let's understand how your pelvic floor muscles or your vaginal muscles are associated with your back. This pelvic floor muscles, again you can see here, this is the side view, the way I am standing. Similarly, this is a side view, and this are your spine or your back, this is your tummy, and this red colored thick structure are your vaginal muscles or pelvic floor muscles. We are just understanding the pelvic floor muscles and the back. You cannot see the baby right now here. Let's understand that how your pelvic floor and your spine is associated. As you can see, a strong base gives a stable building. Similarly, strong V or pelvic floor muscles are responsible for a stable back. And as your base of the building becomes weak, the building becomes unstable. Similarly, weak V muscles or weak pelvic floor muscles can lead to unstable spine or causing back pain. Also, during the process of vaginal delivery, that is giving birth normally or through your vagina, your baby, you can see here, comes out of your vagina, and here your pelvic floor muscles, the red colored pelvic floor muscles or the vaginal muscles, go for a lot of wear and tear throughout the process of the normal vaginal delivery. If you think that you have delivered through a cesarean section, then you will not have the loose vaginal muscles and back pain related to it. That is not completely true. Even though you have not delivered your baby through a vaginal delivery and your baby is being taken out through your tummy, still your body has undergone all the changes of pregnancy for 9 months, like weight gain, hormonal changes, altered posture, and all of this has led to loose or weak pelvic floor muscles already. Let's understand this with an example of a red rubber. You can compare this red rubber with your vaginal or pelvic floor muscles. If I stretch this red rubber and release it, it will come back to its original shape. But if I stretch the same red rubber for 9 months and then there is weight of the growing baby on it, this rubber at the end of 9 months will become permanently loose. Similarly, even in case of your cesarean section, you have undergone all the changes which has already led to loosening and weakening of your vaginal muscles. So, even in case of cesarean section, you can have the risk of having back pain.